Down faces, we know what happens in a down faces. Broad head, epicanthal fold, macroglassia, small chin, slanted eyes, depressed nasal bridge, very classical of Down syndrome. If they ask, it is very easy to say. Down's face is usually endocardial cushion defects, ASD or VSD. Elfin's face is Williams syndrome, supraclavicular aortic stenosis. What is there is a broad forehead, again hypertelorism, puffed cheeks, upturned nose, that is what is seen in Williams, abnormal dentition, abnormal lips, supravalvular AS. These are rare conditions, we do not see in clinical practice commonly. Hurler's syndrome, seen with valve involvement, usually mitral valve is involved. Floppy mitral valve, mitral regurgitation can be, even tricuspid is also rarely involved. Broad forehead, puffy eyes, hypertelorism, upturned nose, poor dentition, large and flabby lips. Noonan syndrome, inverted triangle face, big head, broad forehead, hypertelorism again, as I told you, any hypertelorism I always put low hairline and low prominent philtrum. This is prominent philtrum, this is philtrum. Hypertelorism, low hairline, low set ears. All three go together. What is the association of Turner's? Bicuspid aortic valve or coarctation. Low set ears, webbed neck. One of the conditions you get, webbed neck. Broad chest, wide spaced nipples, short stature, all are features of Turner syndrome. This is a high arched palate. How to identify is, you have at the level of incisors, you look from above the level of incisors, the arch of the palate should be seen in normal individuals. If it is not seen, then it is high arched palate. High arched palate, diagnostic criteria, it's very difficult. You can see in various conditions, Marfan, Noonan, Turner. But most common is Marfan syndrome. You get high arched palate. Clinodactyly, the distal interphalangeal joint is curved. Clinodactyly, syndactyly, syndactyly, fusion of the fingers, and arachnodactyly. Arachnodactyly is a feature of Marfan's, spider-like fingers. You see in Marfan syndrome. This is what is thumb sign and wrist sign. What is thumb sign? You beyond the ulnar border. This is what is thumb sign. Thumb seen beyond ulnar border. That is what is the picture shows. Thumb, little finger overlap is 1 centimeter. That is thumb sign. Wrist sign, again, you little finger and thumb should have 1 centimeter. Again, this overlap, this distance should be 1 centimeter. Transverse single palmar crease, transverse palmar crease. You can see a transverse crease, very classical of Down syndrome.